afternoon, everyone, and welcome back. Welcome back to the podcast of Faithfully Speaking. It's a podcast of good, healthy, positive, informative conversations of various topics. We try to inspire and uplift those who are tuning in, and possibly, we're inspiring you, that you will go out and inspire and encourage others with the information that we share today. So I am your host, Melissa Wade in the Water, and I thank you once again for hanging out with us for this awesome, wonderful podcast. Now, today, during this podcast, we are going to recognize Men's Health Month. It's been Men's Health Month, and of course, this is the final week of it, but we would be remiss not to go ahead and, just divulge some information, some great information that men can use and women we can use for our men, as well as, just some information for us in general. So today we want to talk about the men. We want to encourage our men and our boys to take charge of their health and to make sure that they turn to a healthy lifestyle and find out as much information as possible. And so today I've invited with us to share some information that we can use. My sister in Christ, and she's an awesome, wonderful physician and doctor. Dr. Tiffany Lowe Clayton is our guest today. My sister, how are you?
Good, Melissa. How are you?
Fantastic. And thank you, as always, whenever I call on you and say, hey, I need some healthy information, you're like, I got you, girl.
I got you. Thank you for having me.
Oh, so wonderful, again, just to have you. So for those who may not know you, give us a little bit about your background and what you do.
Absolutely. So I am Dr. Tiffany Lowe Clayton, aka Dr. TLC, and I am a family physician by training. I've been doing family medicine now a little over 20 years, so I've been in the field for a pretty long time. I am also a stress expert and an obesity medicine specialist, board certified in obesity medicine by the Academy. And so my practice really consists of a whole person approach to medicine. So just from preventive care to helping people lose weight and keep it off, to helping them be able to manage their stress and just live healthy overall.
That stress thing, I tell you, is right on time. We're going to hit on that too, as far as mental health and things like that. So let's start off, just kind of an overview with men. We're talking about men's health. What are some of the major things or issues that you would say, Dr. Tiffany, that plague men?
Wow. And first things first, I'm so glad that, we take time every June to just really bring light to these things, because many of the things that actually impact men in particular, and in particular, Black and brown men in underserved communities, a lot of those things are really preventable. So I'm glad you're having this conversation, Melissa, because it's so important. But when we think about what actually affects men, in particular, it's really preventive screening, the screening that they need to have, understanding things that they need to do to make sure that they can stay healthy, and that if something does go wrong in their bodies, that they are getting it caught early on to be able to increase the rate that they'll be able to have a successful end to whatever's going on. So, I mean, you can talk about anything from prostate cancer all the way through things like high blood pressure, diabetes. And I think we should touch on all of them.
Absolutely. Like, that's exactly what I needed to know. Like you mentioned, prostate cancer. We know heart disease is one of the things, and that's not just for men, but for women as well. What are some of the most important things that we need to do? Even if we get, say, an exam and it says, hey, look, we're on the borderline of what's going on. Let's even back it up further than that. Getting that exam, making sure that we have a physician that we trust to give us the right information.
Oh my gosh, you just said a whole mouthful right there. That is it. It's having a provider, somebody who is not just a person that you pick out of a book, but somebody that you really develop a relationship with and that you trust. Because we know that when it comes to, men in particular, Black men and those Black women as well, trusting somebody is really one of the major ways that we're going to break down the barriers to health disparities. So not just having a provider that you like, that you see, that you trust, that you can have a conversation with, But when you leave a provider's office, that you have the answers that you need. So that requires going and being prepared with a list of questions. Don't be afraid to ask questions. That's what we're here for. We want to answer any questions that you may have. But then being with somebody that you can advocate, that you'll feel comfortable advocating for yourself. Because oftentimes, I don't know, Melissa, I don't know if you've ever been to a place where you actually are going in and you may not necessarily understand what's going on, but then may feel uncomfortable to ask the questions. And so you leave and you heard some things, but did you really understand it?
Right. And you bring up a good question. I mean, we can take it as far back as being in a classroom setting. As a
Hmm.
child, you didn't want to ask a question because you feel like if I ask a question, it's going to be a dumb question. So you keep going on, and if you have the right parent, you learn that no question is a dumb question. But it just kind of trickles down into adulthood, and
Yeah.
even for us in history as African Americans, I remember my mom just saying, as they were growing up, how her mom would always tell her brothers, don't just go to any doctor. Don't be walking
Right.
around here. They might do. And so the whole mistrust comes from way back centuries before now. And, we've got to get over this hump. What, are some of the things, or as a doctor, our reservations about asking questions. What advice would you give to us to kind of overcome that hurdle?
Yeah. Well, it's deep. It's much deep seated, especially in the medical community, or what happened to us when we think about some of the health advances that we've made, and we know that we've made many advances in health over the last 100 years. But unfortunately, when you look at the history of that, a lot of that occurred on the shoulders of Black and Brown people and individuals who were otherwise, vulnerable populations. And so there is a large, deep-seated mistrust in medicine, and in particular among those of us who are in the Black community. And so how do you begin to get over that?
Yeah.
First things first is to get a provider that you trust, someone that you can help. So you got to make the first step to be able to do that. But
Mhm.
then also do your own research, do reading. Nowadays, there are many reputable sites that you can go to learn and to understand. And so when you go in, don't go in with a blank slate. Go in already having read what's important for you as an individual so that you can have a very informed conversation and be able to ask those questions. And then when you go in, make sure you understand the schedules that you have. Know when you're supposed to go get your screening, getting your annual examination, making sure that you know your numbers. We say know your numbers. So what is your blood pressure? Normal blood pressure, and this leads to what you were talking about with relation to heart disease. Normal blood pressure is less than 120 over 80.
Mhm.
If your blood pressure is higher than 120 over 80, then you should be having a conversation with your primary care provider about how to take preventative measures to keep it under control. When the blood pressure starts getting above 130 over 80, that is technically now considered to be high blood pressure, or what we call stage 1 hypertension, because we are trying to capture individuals much earlier on. Let's talk
Right.
about heart disease. When we think about heart disease is the most common killer, no matter who you are. Heart disease is the most common killer. But among African Americans, we know that heart disease not only impacts African Americans higher than any other class of individuals or any other ethnicities, but also Black and Brown individuals die at much higher rate from heart disease. And when I talk about heart disease, I'm talking about things like stroke, coronary vascular disease, or things that can cause clots and those type of things. We die at much higher rates. And so we want to make sure that you know your numbers, know what your cholesterol level is, know what your blood pressure is, and also know your blood sugar, because those are the major risk factors that when it comes to heart disease, that will increase a person's chance of having some type of coronary artery disease, or having a stroke or a heart attack in the future.
Absolutely. Now, a lot of this, you can see we coming at many different directions. And I always say, when we have those days where it says take your loved one to a doctor day, a lot of
Yes.
people are like, well, yep, that means I need to take my husband. And it's
Mhm.
unfortunate that most of the time it is taking that man to the doctor who has this whole mistrust, who has this whole, you mentioned something about, sometimes having the doctor that you trust, but sometimes knowing when you need to research and get a second opinion.
Right.
So, many times you have a lot of this coming in and you don't quite understand it, which leads to a little of that, the whole mental health being affected and saying, well, look, I got this number. I don't know what to do with it. I don't know what question to ask. And all of a sudden now you're full of anxiety and mentally you're in a place of not being healthy. Can you address that?
Oh, and it's such a big problem in our community because not only are we dealing with the fact that um, when you think about many of the major health issues that occur, so whether it's heart disease, cancer, obesity,
Mhm.
any of those types of things, when we see how it impacts individuals as a whole, we know when it comes to health disparities, those who are in the Black and Brown community are impacted at much higher rates than our white counterparts. So all of the things that we're talking about really impacts us. I once heard somebody say, when America gets a cold, Black and Hispanic Americans have the flu. We get it at much higher rates. And not only do we get it at higher rates, but we also are diagnosed oftentimes at much severe states where it could have been prevented if it was diagnosed earlier on. But because, we're not going to the provider or, getting our screenings and stuff, we're really uh, walking around with these silent killers for all intents and purposes. And we don't know until it gets too late. So, that's often seen, especially among Black men. And it does take a toll. It takes a toll on our physical health, but it also takes a toll on our mental health. 1 in 3 individuals are dealing with either anxiety or depression, and a lot of individuals are just dealing with increased stressors overall. As a matter of fact, now post COVID, what we saw as a major issue even prior to COVID, now post COVID, is truly an epidemic. I mean, we were in as much of a mental health crisis as we were a physical health crisis. And yet, the same mistrust or the same stigmas that occur in our communities still play in and of themselves. So really you have people who are walking around suffering in silence.
Yeah. Wow. It's so much here. It's just so much here. I want to briefly go to, and I told my listeners I was going to talk about this article I just read because you mentioned, of course, knowing your numbers and cholesterol and blood pressure and all coming together and obesity is pretty much
Yes.
it's something that you specialize in. And when I read this article, I was like, oh my goodness, and basically I have it sitting here. It said, obesity changes the brain with no signs of reversibility. And I'm like, wow, that, of course, we're always being taught, we want to lose weight. We want to be at a healthy weight. But this right here makes you say, wow, it's affecting my brain.
Mhm.
So what are your thoughts, being an obesity doctor of sorts, about this article and the findings?
Yes, and I read the article as well, and it is fascinating when we think about obesity and being an obesity medicine specialist. One of the things that we understand, the more we learn about obesity, the more we realize there's so much more to learn
Mm.
because it is very complex. It is not just something that that what we've told patients for years, just move more and eat less, or that it's about willpower. And if somebody's struggling with their weight, that, they just got to have more willpower, or they just got to, control their urges or, do whatever. And the more we learn about it, we really now understand that obesity is a chronic disease. It's not
Mhm.
something that many people choose to have, nor is it something that without the help of a trained professional, many people who struggle with their weight for years are going to be able to get over.
Right.
I often tell many of my patients, when you are struggling with your weight, and especially if you've been struggling for several years, you're not going to get over your weight. It's not like you're going to get to this destination and then you can go back to life as normal. You got to get control of your weight because it's really a lifestyle
It is.
and it's a journey.
It really is. I mean, just from eating and different things like that. I was just talking to a coworker earlier, him being a male, me a female, and we were talking about different ways of losing weight. And of course, as
Mhm.
soon as I said, guys, have it easier. They lose weight easier. And he began to laugh. He says, that's not the first time I've heard that. So
We don't have the testosterone that they have, nor do we
no.
have the metabolism that they have. So I often will tell people, especially when they're losing weight together, when couples come in and they lose weight together, I said, do not compare yourself to him, because you're going to be mad if you compare yourself to him. But in that article, it was talking about changes in our brains and how that impacts it. And so at what I want to help to kind of dissect that article a little bit, because I think it's important to understand what happens in our brains when a person struggles, with their weight. So we know that there is a large relationship, a very big relationship between our brains and our stomachs, what we call our gut brain axis. And really, the ability for our bodies to be able to recognize when we eat something that we've had enough, that we're full. And so what happens is that when things are going well and all of our hormones are doing what it needs to do, our gut brain axis is in this state of balance. And so when we take something in, we know we've had enough and we're able to portion control. Well, for some individuals, that gut brain axis is malfunctioning. You're out of this balance of sorts. And that's not something that many people do by themselves. You can't, you don't make, that's not your fault. You can't make that happen. It just happens. There's many hormones, and I'll throw a couple of them out. We know there's a hormone called ghrelin, and ghrelin is our hormone that tells us we're hungry. And it's counterbalanced with many other hormones. One of them could be leptin, or the other one could be GLP, this hormone called GLP-1 that tells us, hey, you're full. And when those work, they work in balance. When that balance is off, then we see individuals who may start to overeat, or we may see them start to have issues with craving. And that then creates the atmosphere, in addition to many other factors, of where a person may begin to struggle with their weight and have an unhealthy weight. But then what ultimately happens is that as that person tries to lose weight, that hormone balance doesn't necessarily change. So in essence, what occurs is as you begin to lose weight, your body then begins to think it's taken out of its normal. Even though your original weight might not have been normal, it begins to think it's abnormal. And what our bodies wants to do is protect. So what does it do? It increases our hunger hormone and decreases those hormones to make us feel full. And that's why you see people have struggle with weight regain after weight loss.
Wow. I love the way you just broke that down, because I'm sitting here going through myself saying, I always grew up. My mom, always had dessert after dinner.
Mm-hmm.
So as I grew up, and my son will tell you, he's not a dessert eater. And he always says, Mom, after we eat, you have to have something sweet. And I do. I feel like I have to, or my dinner or whatever I'm eating is not complete.
Mm-hmm.
And I had to learn that I had to trade off certain desserts. I can still have that sweetness, but maybe it had to be something else. So when we say that
Yeah.
it's a lifestyle that you had to, train yourself, is that a good way to kind of look at it, Tiffany, is what I want to know. Dr. Tiffany, for those things, like you said, your brain says, hey, look, this is how much you eat in order to feel full, and you start to lose weight and you eat less, and your brain is saying, whoa, something's
Absolutely.
wrong.
Well, and when we think about a person who may struggle with their weight and the obesity, is really a pandemic. It's more than just an epidemic because it's global. But when we think about it, our biology and how our gut brain axis works is only one piece of the puzzle. We also know that genetics plays a major role. And so if you come from a family, you ever hear people say, I just come from a big bone family, and you're like, oh, no, girl, you just got to move more. No, it's true. They may actually come from a family or a lineage of people who may struggle with their weight. As a matter of fact, we know that if one parent has a weight issue, it increases the risk that their children may have a weight issue as an adult by 50%. If two parents have issues with their weight, if both parents have issues with their weight, it increases that risk by 75%. Wow. So genetics plays a major key, but also and this gets to what you just spoke about, Melissa, is our environment, what we call our social determinants of health, where we live, Do we have access to healthy food? And those learned behaviors that you have growing up. So if you had a bad day when you were a little kid and mom or grandmom said, you know what, I'm going to make you feel better. I'm going to give you a cookie. Well, then as you get older, how do you comfort yourself? You learned it as a child to have something sweet.
Yeah. So with that, obesity and the effect on brain, or just eating, shall I say, I'm gonna just take it back and say eating and the effect on the brain. Are there certain foods that as we, you know, try and reverse our weight gain, or, lose weight, are there certain foods that we can eat that will help us build our brain, so to speak?
Well,
Healthy brain
overall,
foods?
yeah, and I would say overall, when you're looking at having a healthy diet, you really want to focus on a healthy, balanced eating plan. I'm not a big proponent of depriving yourself of any one food group or the other. I think that these deprivation diets and a lot of the fad diets are really just that. If we think about the root word of diet, what does it do? It dies. So these fad diets go to die. We got to think about it more as life giving, so lifestyle. In addition to that, so really getting a balance of things like your proteins, and whether it's meat protein or vegetable protein, getting a good source of vegetables in your diet, because our vegetables have awesome sources of vitamins, and it has fiber, which we know not only helps us to maintain healthy guts, but it also is anti-inflammatory in properties. And then also getting really good carbohydrates in. So the one thing, and I even hurt myself when I say this, is that we gotta cut out the sugar.
That's what I keep hearing. Cut out that sugar.
Sugar's so bad for us. It's the refined sugars that are bad for us. The quick sugar, those quick fixes that we see. Oh my
Right.
gosh, the more we learn about, obesity and what sugar in particular does to our bodies, it's really alarming. The inflammation that occurs in our bodies when we have an overconsumption of sweets, and especially those concentrated beverages, those sugar sweetened beverages, those
Mhm.
concentrated sweets, the cakes, the cookies, the pastries, all those things that we look to many times for comfort are ultimately those things that are going to make us uncomfortable in the end.
Yeah. Now, of course, we have so many different diets that's out there. Mediterranean, you've got,
Mhm.
this, that, and the other. But there's also certain drugs that are
Yeah.
beneficial, have been shown to be beneficial. And you said that there are, some caution that needs to be taken, and some information that we need to know when it comes to those as well. Can you share that with us?
Absolutely. When we look at being able to lose weight, and I would like to back up just a little bit and just say we know that we were talking about men's health and being able to ensure that we prevent things such as heart disease.
Right.
Well, one of the things that we know when we look at the common risk factors for heart disease: high blood pressure, diabetes,
Hmm.
high cholesterol. However, if we actually were to look at the risk factors for developing those three things, we know that obesity is a major, major risk factor for developing those things.
Yeah.
So when I look at preventing those types of diseases in individuals, I'm also looking at making sure that patients get to a healthier weight, because we know that something as simple as 5 to 10% of a person's base of if they can lose 5 to 10% of their baseline body weight, it
Hmm.
can not only improve, but it can reverse those health conditions that we know can lead to things such as heart disease. So just 5 to 10%. So if a person has 100 pounds to lose, just losing 10 pounds, they've already gone a very long way at improving their health overall. So, when we think about what types of foods to eat and what diets do we need to be on, again, think about it more as a lifestyle,
Hmm.
also a balanced meal, and making sure that you're eating well. And recognize there is no one size that fits all for everybody. So
Hmm.
it's really about going to see a trained provider, somebody who can talk to you about it, really understand how do you eat? What are your triggers to eat? It's not just what you eat, but it's also why we eat. And then really understand that, if you're a person who craves sugar, let's put you on something like a low carb eating plan where we can make sure that, you're getting away from those concentrated sweets. Or if you're a person who has high blood pressure, maybe we need to put you on a plan that will help to not just help you lose weight, but also will help to manage your blood pressure. So I guess that's all to say that, when we think about what the right plans to be on, it really has to be individualized for that person. And that's where the conversation needs to come in.
Absolutely. So again, with those diets that are there, they've been there for a while. And like you said, we need to figure out which one best suits us. But then, like I said, the medications that are there, they have, those kind of, I don't want to say quick fixes, but, if we can get a quick fix, that's exactly what we'll do. Hey, if you can give me a shot for it and instead of me going on this diet where I'll have to do all this, it benefits me. What are these medications, and are they safe?
So we know that yes, they are safe. They are very safe. The medications that we have out now, and there's quite a few that are out, whether you'll take an oral medication or when patients come in and say, I heard about the shot. I want the shot because I heard that the shot works fast. I think you bring up such a good point. There is no quick fix. If there was a quick fix, we would have had it a long time ago. But what we also know is that when we look at the use of medication and the effectiveness of it, medication along with lifestyle modification, the two together are really our best formula to help people lose weight and keep it off. So yes, you do have to do lifestyle modification. You can't get away from that. We do have to increase our physical activity, whatever that may be for that person. We do have to make sure we're eating a healthy diet. We do have to watch our stress level and how we respond to the triggers that may make us eat. But then to be able to overcome that phenomena I talked to you about early, metabolic adaptation with the hormones, that's where medication can then be really useful to help us be able to overcome that and to help people control their appetite or to control their cravings. The one in particular that's the biggest craze that I think everybody's talking about is semaglutide, the otherwise known as the shots. And we have different types of formulations. Some of them we take daily, some of them are weekly. And the ones that are out currently right now, the branded named of those that we call the branded ones are Wegovy and Saxenda.
Right.
They right now are the only two that are currently approved for weight loss. Those are the only two that are on the market currently approved for weight loss. That is it. There are some others that we know are on the horizon that they're getting ready to come, but we also know that they are expensive. And so they work, they do a very good job. We've seen an improvement in weight, baseline body weight, up to 15 to 17% in some of those patients, which is significant. However, the restrictive piece of it is that they can cost upwards of $1,000 or $2,000 if your insurance company does not pay for it, which is why we're now seeing the advent of some of these generic medications that are coming from some of the compounding pharmacies, because patients can get it a lot cheaper. The thing about it is that when we think about those compounded medications, we cannot attest to the safety or the usefulness of those medications because they just have not been studied. They're not FDA approved. And so we don't even know where they're necessarily coming from or what other components they may have in it. So when we think about the long-term side effects of taking those generic forms of medication, we really don't know what those side effects are. So I would discourage people from taking it and really just having a conversation with their healthcare provider about what the best option is.
That kind of goes back to a disparity. I mean, only the rich will be able to get the right drug and have the advantage of having the drug to lose the weight, and those who don't will continue to go after something in hopes that it will work. But like you said, you never know what the outcome will be. So,
well, yeah, it is those that have versus those that don't have, but it's also in being able to continue to advocate that obesity is a chronic disease. There's a lag. There's actually a lag in insurance companies or legislators really understanding that this is not something that people choose, and it is more than just willpower. It's a chronic disease state. And so the more we can advocate as patients, as physicians, and get our local legislators, more informed about it, then the hope is that more insurance companies will start to cover these medications because they do help our patients get to a healthier weight, and not just to a healthier weight, but just a healthier profile overall.
Mm-hmm. Altogether. All right. We've come up on our 30-minute session right now. We're going to kind of wrap things up as we kind of go back towards just kind of highlighting men's health as we wrap up. Give us briefly those screenings. If you were to talk to a man right now, he says, okay, what are some of the first things I need to do? I'm finding my doctor, I'm finding my physician. What are some of the first things I need to ask my doctor to do, as especially an African-American man?
Yes. So first things first, if you do not have a doctor, find one. Find a primary care doctor. So whether it's a family medicine doctor or an internal medicine doctor, make sure that you're finding that. And get your physical exam. Get your screenings. So what are the biggest screenings that we need to have? Your prostate screening. Prostate cancer is the second most common cancer in men, secondary to skin cancer. And Black men in particular are not only 2 times more likely to get prostate cancer, but they're also nearly 2 times more likely to die from it and will get diagnosed at advanced ages. So when do you need your screening? If you are African American and you're high risk, at least at 45. But if you have a family history of it in a first degree relative, you need to be getting screened at 40. That is not just the blood test, which is what we call the PSA test. So not just the blood test, but also a rectal examination. That is important to get done. And like I said earlier, if you catch it early, the survival rate from it is actually very good, but an ounce of prevention is worth a pound of cure. So go get your screening for that if you haven't had it. The second thing is colon cancer screening. It's now recommended for colon cancer 45 years old. But we also know, again, that African Americans in general, but Black men in particular, we're seeing an increased rate of colon cancer in those individuals under the age of 50, which used to be the old screening. So 45 years old right now is the recommendation. If you have not had your colonoscopy, you definitely need to get that done, especially if you've had a family history. You may need to even get it done even beforehand. And then, again, we talked about heart disease a bit more, but just know your numbers, get your blood work done, know what your cholesterol is, know what your blood sugar is, know what your blood pressure is. And if you have any of those types of things, work to get those things under control, because we also know that as Black Americans, we are diagnosed with high blood pressure at higher rates, but are less likely to have it under control, which then increases those risks for heart disease. So those are going to be the biggest screenings that we have. And again, if you have questions, don't be afraid to ask those questions. Don't be afraid to get a second opinion if necessary, or you don't understand something, or you don't have a good relationship with your doctor. Don't be afraid to find a new one.
That's good advice. Very good advice. So as we wrap up, Dr. TLC, I love that, by the way. Tiffany Lowe Clayton.
Yeah.
Give us some information, maybe, if you're the one they want to contact, especially when it comes to, obesity.
Mm-hmm.
How do we get in contact with you?
So I am currently practicing my clinical practices with WakeMed, and I'm in the Raleigh and Fuquay locations. So they can go to wakemed.org and look up WakeMed Bariatric Surgery and Medical Weight Loss, and they can contact me there. I'm also on all social media channels under Dr. Tiffany Lowe Clayton. Very easy to find me there. So definitely, I would love to be able to help anybody be able to meet their health goals overall.
All right. Well, Dr. Tiffany, thank you so very much for hanging out with us, sharing the knowledge. And I hope that those of you who are watching right now, well, I won't even hope, I know that you've gotten some information that you can definitely take and share and encourage someone else to say, hey, look, it can be done. It can be done the right way. Here's the right knowledge. Yeah. Here's what you need to make it happen. So again, Dr. Tiffany, thank you for joining us for Faithfully Speaking.
Thank you so much for having me.
You're very welcome. All right, everyone. Until next time, next Monday at 3, we will see you back here for the podcast of Faithfully Speaking with me, Melissa Wade in the Water. God bless you. I love you. Grace and peace.